as we commemorate National Suicide Prevention Week, there are growing calls for more help and support in driving mental health and awareness in townships and rural communities. According to the South African Depression and Anxiety Group, there are 23 known cases of suicide in South Africa every day. Let's discuss this further now. I am joined by Khethiwe Nkuna, who is an executive responsible for business at Accenture South Africa, as well as the chairperson of the Mental Health and Wellbeing Committee. As also on the line, we have DrThabo Mogotlane, a specialist psychiatrist at Mediclinic Legai, and Nkini Phasha, who is a board member of the South African Depression and Anxiety Group. And I have to thank you for being in studio with us, Khethiwe, and to the gentlemen joining us on Zoom too for this very important conversation. And I'd like to start with you, Nkini, from SADAG, because you deal with this on a daily basis. Now 23 known cases of suicide, and I think the operative word here must be known. If you can paint the picture in South Africa, how big of an issue is this?
Thank you very much, Masa, and good evening to you and the viewers at home. We are really sitting with a huge issue, in South Africa when it comes to this, topic. I think, if you look, maybe if I just look at the numbers and just paint the picture for you, we are saying that 1 in 3 people in South Africa are currently suffering from a type of a mental health condition. Now, that if you take that into our population, that is about 20 million South Africans that are suffering from a type of a mental health condition. We know that out of that, only 1 out of 9 of those people that are living with a type of a mental health condition are actually getting treatment and management of their condition. We know that there is a very strong link between untreated mental health condition or illness and suicide. So really the figures that we are seeing, and I think you would remember in about a year or 2 years ago, the statistics that came out, global suicide statistics that came out, showed that South Africa is in the top 10 of the countries in the world that are actually having the highest rate of suicide. We are seeing more young people also turning to suicide, as a solution. Over 10% of teen deaths, in our country are as a result of suicide. So, the figures are actually quite startling.
They are alarming indeed. And Dr. Mogotlane, as we're listening there too, just a matter of untreated, going untreated as well, and the point of access. And that's also where you come in with Mediclinic Legai. Tell us about just the problem of mental health challenges, particularly in townships and rural areas.
Thank you. It's a major problem, and in the township, it's just a reflection of what we have in South Africa in general. There was a study which was done, which is called the South African Stress and Health Study, and according to that study, the 12 months prevalence of any mental illness is about 16.5%, with disorders like anxiety disorder, depression, and substance use disorders coming high on top. So it tells you that this is a major problem. It becomes worse in the townships because of lack of services. And if I can tell you, almost all mental disorders, they have a certain percentage or prevalence of suicide. So they carry a risk of suicide. You're looking at depression, it carries a risk of suicide. You're looking at schizophrenia, it carries a risk of suicide. Looking at bipolar disorders, they carry a certain percentage, a risk of suicide. Same applies to substance use disorders. So that is a major problem. It becomes worse when you have an underlying personality disorder. So it puts you at risk of other disorders like substance use disorders, like depressive disorders, and suicide as well. So that's what we are facing.
And just, Doc, on that too, when you are looking at the environment, particularly of those who are living in impoverished conditions too, does that also add on to this?
Yes, definitely. The environment plays a major role, because looking at disadvantaged communities, especially in the townships, poverty plays a major role. There's actually a bi-directional relationship between poverty and mental illness. as we always say, once you're exposed to poverty, now you run a risk of developing mental illness, and you run a risk of limited services as well because of that poverty. Same applies to mental illness. Once you develop mental illness, it means that now you run a risk of losing your job. Then that puts you at risk of what? Of poverty as well. So there's a bi-directional relationship. So the environment plays a major role. In addition to that, there are just other psychiatric disorders which are just triggered by environmental factors like schizophrenia. As long as you have the genes for schizophrenia, you can harbor the genes without the disorder being activated until you are exposed to stressors, until you're exposed to substances which are environmental factors. They will trigger the disorder. So the environment serves as a precipitating factor, as a perpetuating factor, and also it can serve as a protective factor if you have a good support system, a good family support, a good community support. It can serve as a good system for recovery as well. So it plays a major role.
And as we're just listening to the doctor there, Khethiwe, we're talking about, how it can affect you in the workplace as well. And I love that we're having an all-rounded conversation for those who are facing these problems, unemployed, but for those who are employed too. Now, according to the WHO, for every 1,000 workers in an organization, 200 to 300 will suffer from some sort of mental health condition as well. We've just heard 1 in 3 people, approximately 20 million in South Africa, suffering from some sort of mental health condition. From a corporate space, from an organization workplace position, how does it manifest and what should corporates be doing?
So I think one of the things that's encouraging is post-COVID and lockdown, I think with loneliness heightening and organizations also having their employees working remotely, we really did put the spotlight on mental health, But as Nkini mentioned, 1 in 3 people, that is the same in corporate South Africa. According to the World WHO again, the South African economy loses around 232 billion annually because of absenteeism and presenteeism. That is people coming to work while they're not well. And often it is because they're afraid to actually speak up and actually say that I'm actually going through a challenge mentally. I'm really feeling low. I'm going through bereavement. I've lost a parent. I've lost someone close to me. Because of fear, right? And because of stigmatization, people fear that if I disclose to my employer, I will be seen probably as someone that's incompetent, So what is important is for employers to really lean in. So organizations like ourselves, Accenture, we've really been on a journey of humanizing the workplace and truly creating a safe space where people can truly say, that I am not okay. And it's not just words where we say, you need to speak up, and it's okay to not be okay. How that happens is through the safe space and leaders leading by example and showing their own vulnerabilities and sharing their own story around mental health. That is how we humanize and really create a safe space and psychological safety so that those that are actually suffering do actually reach out. How do we also put in place the support structures and educate? I think education plays such a critical role. Yeah. Educating our employees, educating people. We've got what we call the mental health allies. Other organizations call them signposts, And those are people that are there to signpost people to help. It's when you observe that my colleague's behavior has changed, how do you lean in respectfully and positively inquire to say, I've observed your behavior has changed. Are you okay? And how can I actually support you? And should I call the employee assistance program for you? So it's really important to create that space. And I think leadership should be at the forefront of that to make sure that we are humanizing the workplace and creating a space where we are destigmatizing mental health.
Speaking of leaders as well, walking the talk as well, and also showing their vulnerability, there's a phrase that people leave people, not organizations. And a lot of the times it's people not wanting to come to the office space because there's somebody in that environment that's creating a toxic environment for them. In a situation like that, where the person who's your direct line manager is the person that is creating that toxicity, is that when these support structures come in place? Because a lot of times employees will say, look, I don't trust to go to the HR department. I don't know, because they're getting their salary from this organization in the first place.
Absolutely. So it's the likes of the mental health allies, but also lines where people can actually report, you know, so there should be an ethics line where people can report independently, you know, and I think to this point, a very important point of zero tolerance to bigotry and zero tolerance of discrimination, but also retaliation. A lot of people do fear to raise concerns because they do fear, as you were stating, retaliation from the line manager. You know, a couple of weeks ago, we were privileged to hear Dr. Ngao speaking about the role of bystanders. You know, there is no innocent bystander. So if people do witness someone going through that, you know, and you are a team and you know that this particular manager is treating the particular individual in a certain way, it's your responsibility to actually raise it, you know, or get someone more senior that can raise it. Speak to the mental health allies. Speak to someone that is neutral if people do have concerns around HR.
When we come back, I want to continue this conversation with our guest in studio and, of course, our guests on Zoom, so do stay tuned. Well, we continue our conversation as we commemorate National Prevention Suicide Week with Khethiwe Nkuna from Accenture, as well as DrThabo Mogotlane, who is a specialist and psychiatrist at the Mediclinic Legai, and Nkini Phasha, who is a SADAG board member. Now, Nkini, before the break, we're listening to Khethiwe just talking about humanizing the workplace as well, and no innocent bystanders too. As SADAG, you also spoke about access and the potential and the threat of mental health conditions not being treated. The calls that you're getting, are you getting a pattern to see that? Is it more people who are depressed because of unemployment? We know we have a high unemployment rate, or is it the employed people? Is it males? Is it females? Race? The demographics of the kinds of people.
Absolutely, you know, it's really a mixed bag. You know, I think when you look at the dynamics in our country, is that we have, you know, one of the highest unemployment rate, you know, in the world. So for those that are actually employed, you know, we did a survey, the workplace survey a couple of years ago as SADAG, and found that 2 out of 3, you know, employees don't feel comfortable to come forward and disclose that they are actually living with a type of a mental health condition. You know, they are scared that they are going to be, as Khethiwe mentioned, they're going to be discriminated against. They're going to be seen as being incompetent. You know, so we know that a toxic work environment really can be very crippling and very disastrous. So, you know, we are getting calls. You know, really it's a mix because you can imagine the socioeconomic you know, factors play a role. So if you are now unemployed, you cannot be able to provide for your family, that really puts you in a very, you know, stressed, you know, phase of your life. But also, you know, when you are employed and you are, you know, fortunate enough to be able to provide for your family, but the conditions in your workplace are actually not conducive, you know, for you to be able to thrive and for you to be able, you know, to perform at your absolute optimum. You know, I just want to also link in here, and this is something that Khethiwe also, you know, spoke about, education within the workplace. Critically, you know, our line managers, you know, even employers, you know, at most senior levels, they are really not prioritizing, you know, mental health within the workplace. It's still pretty much a topic that is, you know, sort of, you know, shunned away. It's, you know, not spoken about. So really educating, you know, the employers, educating the line managers, you know, and to really put, you know, this mental health conversation on the table and really have practical, you know, programs in place that will ensure that this is actually obtained, that the zero tolerance, as Khethiwe has put it, is actually effectively, you know, implemented, and that the employees can actually enjoy, you know, the benefits thereof.
Yeah, and it's quite important that we're talking about education as well. The work that SADAG does, you know, in terms of resources, you have to obviously cater for the entire country, but are people able to access you with the resources that you're given?
Look, we run several toll-free helplines, 24-hour helplines. As a not-for-profit organization, you can imagine that our resources, particularly financial resources, are quite limited. So through creating a network of support groups, in the country, particularly in, those rural, deep rural and townships where access, to mental health, management or facilities is actually non-existent. That's how we actually step in. We've got a call center with trained counselors where, we are able to then offer that counseling over the phone. We run various programs where we go into the communities to be able to empower our communities, engaging with various stakeholders within those communities. So through these kind of interventions that we've put in place, through social media as well, we run, programs through social media as well to drive the awareness and the education, pertaining to mental health, conditions, and also most critically, how then people can actually access the help, the treatment and the management, of their mental health condition.
Incredible work indeed. And Dr. Mogotlane, you were also talking earlier about this link between untreated mental health from when you're a kid to an adolescent, and how it creates the cycle of poverty and just also perpetuates it as well. The work that you're also doing in Soshanguve, what are the kinds of problems that you're seeing on a daily basis?
Mainly in that area, we see high rates of depression and anxiety. And we also see increasing rates of substance use related issues. Those are major problems. But in addition to that, because of trauma and violent crimes, we see a lot of post-traumatic stress disorder as well. So those are some of the challenges. There's also a lot of patients now presenting with culture-bound syndromes, meaning that they will interpret mental illness as a culture-related issue. But I think because of the awareness and education, most of the people these days, they also consult psychiatrists because of that. So those are some of the challenges that we see in our Black communities.
And speaking of our Black communities as well, Doc, how do you find that our families are relating when people are coming through to their family members and saying, I think I may be suffering from anxiety or depression? Is it well received? Are we getting better at that?
It is a major challenge, and it serves as a barrier when it comes to health-seeking behavior. And it's what we call stigma. Most of our families, especially in the Black communities, they're still stigmatizing mental illness, and mainly because of a lack of education, and also because of cultural beliefs. Mental illness is interpreted as witchcraft, is interpreted as punishment from the traditional, from the ancestors. Is interpreted as a calling which requires one to go for initiation. So we are not saying those things, they don't exist, but we are saying you need an expert who's going to make an assessment and determine as to whether you need ugogo or you need a psychiatrist. So you cannot separate the two. Human beings are very complex, so psychiatry does not answer all the questions, and we understand. So it's very important to consult so that you get a proper assessment and a proper diagnosis, so that you get a proper referral and a proper treatment.
This style of leadership, the hard style, the devil wears Prada style of leadership, are those days gone? Are we shifting at a slow pace, Khethiwe?
I think we definitely are. I've definitely seen more and more leaders, understanding and leaning into more their empathetic leadership, especially female leaders. I think naturally feminine leadership does provide itself more to empathetic and more in tune leadership, where we are natural nurturers, but I'm seeing my male colleagues as well, because we also understand that if this is perpetuated, the devil wears Prada, harder type of leaders, for example, this has an impact in terms of the profitability of the organization, because there's high levels of turnover. You mentioned earlier on that people leave leaders and not organizations, you know, so it's really important to make sure that, one, leaders are empowered also to build inclusive cultures, right? Because the more people feel that they belong and they don't need to cut parts of themselves out to show up in an organization, the higher the productivity of the organization, the higher the innovation, and the higher the profitability as well. So those are some of the reasons that it is no longer, you know, the norm where people are leading by fear, you know, and people are really leading with an iron fist. You know, empathy is actually a strength, and vulnerability as leaders is actually a strength, where you are also, I often say that by being vulnerable, you know, and showing up as your authentic self, you give other people permission to do the same. The people that you are leading then emulate what they see you as a leader doing.
Yeah. Just quickly from you, Nkini, I just want you to just give out those details for anybody wanting to reach out to SADAG, and also for the doc, if you could quickly just give out those details, starting with you, Nkini.
Sure. So I will start with our suicide helpline. That is, the number is 0800 567 567. We also have a substance abuse helpline. It's 0800 12 13 14. We run an SMS line as well, where, you know, people can send, please call me, and our counselors will then immediately get in touch with them, and that SMS code is 31393. And of course, on our website, there's a plethora of, you know, information that really can empower our people. And our website address is www.sadag.org. And, you know, obviously we are also present on social media, Facebook, Twitter, Instagram, LinkedIn. People can obviously check the South African Depression and Anxiety Group. They'll be able to access our social handles.
All right, and we're just about to wrap. So, Dr. Nkuna, just Dr. Mogotlane, just quickly those details too.
They can Google Mediclinic Nahai. Our contacts are there, and this is the direct contact to the practice, 012-797-8133. Even if they can check on Facebook, our contacts are there. We also have a WhatsApp. If you log into our website, you'll find a WhatsApp number. We are, yes, thank you.
Thank you so much, gentlemen, for your time. I think we could talk about this again. It really is a conversation that needs to be extended. And of course, to you, Khethiwe, thank you for coming into studio.